Training adults with Asperger's syndrome to conduct PECS trials to children with autism.
By Lindsay Ellenberger, Miranda Morton, and Ashley Walsh.
A multiple baseline design across participants was used to evaluate the outcome of a peer-delivered behavioral skills training program. The purpose of the current study was to extend research on BST by using high-functioning autistic peers as communication facilitators and children diagnosed with ASD as communicators during Phase 1 of the Picture Exchange Communication System. Behavioral skills training, as described by Sarakoff and Sturmy, was used as an intervention package to train the participants on implementing Phase 1 of PECS training. The results showed an increase in mean correct responding for participants that were trained to conduct PECS trials using BST. The Confederates who were taught how to communicate using PECS also showed an increase in the mean correct responding.
Individuals with autism spectrum disorders have reported having few close relationship and social interactions compared to their peers, despite a reported desire for such interactions. The Picture Exchange Communication System, PECS, is a widely known procedure commonly used with children with autism. PECS greatly facilitates communication between individuals with developmental disabilities and their peers. Video modeling has also been shown to foster appropriate verbal and physical communication during social interactions with autistic children. Peer-delivered teaching procedures have also been effective in increasing appropriate requesting and in generalization of newly learned skills. The purpose of the current study was to extend research on BST by using high-functioning autism peers as communication facilitators and children diagnosed with ASD as communicators using Phase 1 of the PECS system.
The participants in this study included 1 graduate student and 3 participants with high-functioning autism spectrum disorders and 3 Confederates who were not trained to use PECS. Training was conducted after school hours at a Midwestern school for autism that the Confederates attended regularly. Training sessions took place in an 8 by 10 foot room with 7 chairs, a table, a PECS board, pictures of preferred items, and a bin filled with preferred items pictured on the cards.
The first primary dependent variable was the percentage of procedural fidelity components implemented correctly by participants. Trained graduate students collected data on correct and incorrect responses for participants and Confederates throughout PECS trials. The second primary dependent variable recorded was percentage of correct responses emitted by Confederates during the 4 trial performance sessions.
2 independent observers recorded correct and incorrect responses emitted by the participants when conducting PECS trials. They also recorded correct and incorrect responses made by Confederates when receiving PECS training. The total number of agreements was divided by the number of agreements plus disagreements and then multiplied by 100 to convert it to a percentage.
A multiple baseline design across participants was used to evaluate the outcome of the behavioral skills training program. Following baseline, an intervention package was introduced to participants that consisted of verbal and written instructions, modeling, and feedback described by Sarakoff and Sturmy. In situ, BST was used to train the participants on implementing Phase 1 of PECS training. Behavioral skills training was given by a second experimenter, while the first experimenter acted as the PECS implementation helper. Each session consisted of 4 PECS trials, consisting of 10 steps to be completed. A trial was considered completed once all 10 steps of the implementation checklist were completed with or without prompting. Generalization probes were conducted randomly throughout the experiment.
The experimenter, a trained graduate student, gave the participants all necessary materials to conduct PECS trials. The participant was told Do your best to get him or her to ask you for something in the bin using the picture board and pictures. You will be the communication facilitator and I will be the helper. Baseline was conducted with 3 different participants, 3 different Confederates, and 1 experimenter that acted as the helper for all 3 participants.
Each participant taught a different child Confederate to communicate during Phase 1 of PECS training. The experimenter provided verbal and written instructions, provided a model of procedures, and provided feedback during the in situ training sessions. After each trial, when the child Confederate was allowed access to the item he or she communicated for, the researcher gave feedback to the participant about the aspects of the trial they performed correctly and incorrectly. In the presence of an incorrect response, a model was immediately given, and the participant was to practice that aspect of the procedure with prompts from the experimenter until independent correct responding occurred.
Generalization probes were conducted randomly throughout the experiment. Generalization was tested across settings for each participant and Confederate group. Settings assessed for generalization included the playground and the sensory room.
The results showed an overall increase in mean correct responding with both Confederates and participants.
Results from the behavioral skills training sessions showed an overall increase in mean correct responding for all 3 participants conducting PECS training. This suggests that teachers, parents, and trained professionals are not the only populations that can train Phase 1 PECS communication to children with autism. Limitations include the lack of a role play aspect that Sarakoff and Sturmy 2004 used for BST. Generalization should be tested to see if the use of BST with PECS can be implemented for individuals with visual impairments to increase social communication skills.
This graph depiction captures the overall data collected during this intervention.
This is the procedural integrity checklist used by experimenters when scoring participants implementing PECS trials.
This is the social validity survey completed by the participants.